her stomach, we're doing what's called an anterior dorsal. As you can see, she is 26 weeks pregnant. So she's complaining of some lower back pain. We want to make sure which side of the pelvis is or isn't moving. Sometimes the side that hurts is moving too much. And go ahead and lean forward again. And this one is locked up. So that is already moving. Beautiful. All right, so you feel this? It's kind of tight. So now we just kind of massage that. Okay. And then here's our pre and post here. This was before, you had lots of oranges in the uppers, and now they're evening out to some greens and yellows. Hey Boulder, this is Dr. Ryan with Upper Cervical Chiropractic of Boulder. And this here is Christina. As you can see, she is 26 weeks pregnant. So we're gonna scan her because she's been under regular upper cervical chiropractic care for a while. We wanna make sure that's still clear and connected before we start doing some low back, mid back stuff because she's been having some pain in those areas. All right, so let's scan you here.
Okay.
And we'll do 2 for good measure. All right. So yes, you are in pattern, ready to be adjusted. So before we do that, we'll do the full spine stuff first. So I'll have you sit on the end of the table here, face this way. We'll just do a couple tests and we'll explain what these are for. Kind of straddle here. So she's complaining of some lower back pain. We want to make sure which side of the pelvis is or isn't moving. Sometimes the side that hurts is moving too much. So that's what we're going to check here. Okay, go ahead and lean forward. All right, so this one is moving maybe too much, so come on back. And go ahead and lean forward again. And this one is locked up, so that is a left pelvis misalignment. Come back up. So, you also had some mid-back right around here, you said? Mm-hmm. All right, I'm gonna have you scooch back on the table, just so your knees are about there, okay? And I'm gonna do a big hug here.
Okay.
Give me this hand. You've done this before, correct?
Yes.
Okay. So bring your chin down. So since she can't lay on her stomach, we're doing what's called an anterior dorsal. So my hand becomes the fulcrum here, and I can hold your weight. So you just kind of be limp, all right? Here we go. Amazing. Great. How's that feeling?
Oh, much better.
Great. All right. So lay on your side, face me this way. So, a little pillow for your head here. Would you like a pillow for your belly as well?
I think I'm good.
Okay. So scooch towards the edge a little bit. Straighten this leg here and bend this one. So this is a regular side posture adjustment. The only little tweak here is we want to make sure we're not rotating the pelvis. So we're going to keep everything in line and have just a straight P to A. So this was the side that's hypermobile, so I'm going to focus on the sacrum portion and try to shift that from the left over here. So give me this hand here. Kind of pull that shoulder down. There we go. Comfortable?
Yes.
Have you had one of these adjustments before?
Not particularly like this, but
okay.
Similar.
So you're going to probably feel like you're going to fall off the table, okay? So just know you won't. I'm holding you. I'm in the way. And then once I roll you a little bit, I'm going to be pushing right about here.
Okay.
Okay? You tell me if you feel any discomfort with the baby belly.
Okay.
Okay? Beautiful. How are we doing?
Good.
Okay, roll over to this side.
Okay.
All right. Same thing, scoot your hips a little closer to me.
Okay.
Raise this one. Give me this arm again. There we go. Okay, this is contacting that SI joint again. So we're really going to make this move, and then we're going to test that again.
Okay.
already moving. Beautiful. Okay, come on up.
Thank you.
Scooch towards the end. Let's make sure those are moving. Okay, we'll test this right side again. Go ahead, go through the legs. You can see this side is just moving up. Okay, come back up. This is the one that didn't move, so go ahead, go down. And there she goes. Beautiful. Come back up. All right, how was that?
That was great.
Fantastic. All right, so let's hit your upper cervical listing now. We like to save that for last so we don't mess any of that up.
Very good.
So come on over here. And then, yeah, face me this way. Okay, scooch down. There we go. You know the drill.
I tried.
I'm actually gonna have you scooch down a little bit more. Right there. Where's my little knob? Oh, duh. Cut that out. Make sure to get the tissue pull here so we have a nice clean contact. Okay. Then we're ready for a rest, take a nap, and we'll come back and chat.
Sounds good. Definitely improved.
Okay. And then here's our pre and post here. So as before, you had lots of oranges in the uppers, and now they're evening out to some greens and yellows. Yay. So overall, great adjustment. Hopefully that holds for as long as possible. So now I'm going to have you lay here on your back with your knees up, and we're going to work on that round ligament stuff we talked about, okay?
Yes.
Perfect. All right, so what I'm going to be doing here is the uterus is held up and held in place by the round ligament, okay? That's this guy here. So sometimes when the pelvis misaligns, that gets really tight. All it needs is a little bit of a massage. So relaxin is also a thing that gets throughout the whole body, and it kind of messes up the connective tissue, the ligaments, sometimes even some discs. So we want to make sure that the uterus is in a healthy position so the baby has the most room and can be in a proper position pre-birth. So let's show you how that works. So there's this thing called your ASIS. It's kind of the bony spot right here. So I'm going to kind of slide in and under up that. So it's not uncomfortable, but just let me know if anything is, and then we'll go from there. I might even feel a kick. All right, so you feel this? It's kind of tight. So now we just kind of massage that. That okay? Mm-hmm. And I'll kind of follow it up. Yep, keep breathing. Wow. It just relaxes as we do that. All right, let's check the other side. That was the side that was stuck. So this one's hypermobile, so I don't imagine it'll be tight, but you never know. Yeah, this side's just loose as a goose. Yeah, we can leave that one alone.
Okay.
All right. So that concludes our visit here. I just want to also explain we have this thing called a pregnancy pass. It really walks through whatever portion of pregnancy that you're in and is catered to your needs. We like to create a plan of, your whole birth plan like an OB, like a whole team of people, right? So doulas, midwives, us, that kind of thing. So if you're pregnant and you're having some issues, feel free to come on in. We'd love to have you. We do specialize and focus on the upper cervical spine to keep the whole body functioning properly, but you need a little bit extra, right? So Christina, you're happy, feeling a little bit better?
Yes.
Great. We'd love to make sure that pelvis is moving as well as we can. All right, and I'm Dr. Ryan, Upper Cervical Chiropractic of Boulder. See you next time.